We have so much of this routine data. If only we could use it beyond just keeping track of our patients.
It sounds like you could benefit from an RHIS.
Okay, what is RHIS?
Routine Health Information Systems, or RHIS, contain data collected continuously about health and vital events when people visit a health facility. They are aggregated at various times, daily, monthly, or other intervals. In fact, with the outbreak of the novel coronavirus, COVID-19, these data can help track those people who may be infected.
Funders are investing more money into making this data really good, complete, on time, and accurate. I'm sure it would be useful beyond our clinic if I just knew how.
Well, there are a lot of people wanting to know if these data can be used for evaluation. That means research. But remember, these data aren't random, so be very careful about the conclusions you make.
Wow, that would make sense. It's already here, so it could save money that researchers might spend on conducting health surveys. But I can see some problems with this data. Some of the fields aren't filled in, and some have dates, while others don't. Surely there's still some way to use them.
The first thing to know is what is the research question, and will these data help in any way to answer that question? In fact, if the question is one of outputs, like how many, these data can often tell you things such as how many children were immunized, for example. But if the question is one of outcomes, like what happened? Did those people get cured? Were babies safely delivered? If that's the question, then these data may not be what you need. So let's take stock of the good and the less good about using RHIS data for evaluation. 1. Are the data of high quality, free of mistakes? 2. Do they line up, or is each facility collecting in a different way? 3. Can you measure consistent indicators over time? Or did those change? 4. Can you get permission to use the data? 5. Are the researchers familiar with the data context in those records?
That's a lot to consider. Researchers need to think carefully.
Yes, but I know it has been done in some places. For example, in Ukraine, an impact evaluation used several data sources, sometimes called data triangulation, including baseline and endline data from health facility records, to look at diagnosis and treatment outcomes when TB and HIV services were combined. One advantage of data from routine information systems is they are usually collected over a long time. A study in Tanzania was able to use routine data to determine if people were accessing health services more often in areas of the country where public health services were actively strengthened and promoted. In Mali, routine data was collected to use in future evaluations of a national family planning campaign. The objective was to see if the number of people using family planning methods went up or down year to year.
You were right. I think the bottom line is that routine data are useful in many ways.
And it's important to know that RHIS can be helpful during the coronavirus outbreak. As long as communication among RHIS managers and national public health officials is a top priority. That is, in part, because routine health information systems contain crucial data that can be used to help everyone. And with continued investment and training for data collectors and data managers, we should expect researchers will continue to come up with methods that make use of this information.